Very good. We are live out on the web somewhere, and this is December 7th meeting of the PHSC Committee of the Board of Commissioners for the County of Berrien. We have a number of committee business matters to take care of. First would be the roll call, and Annette, will you do us the favor?
Absolutely. Commissioner Freeling.
Present.
Commissioner Ballrat.
Here.
Commissioner Chickering.
Here, and that should denote that we are all present in the room.
Absolutely.
Thank you. We have minutes to approve.
Well, you would have if I'd have sent this to you.
Okay, well,
So we'll just do those another time.
we'll do those another time.
Sorry.
Let's hope we get back together again.
Yeah, you will.
Okay, one of the important things we have to do is a number of critical resolutions that need to be approved by our committee so that they can be in turn approved, hopefully by the full Board of Commissioners on Thursday. We have 5 of those, and Courtney Davis is with us via Zoom. Hello, Courtney.
Hello, how are you?
Good.
Good.
Would you do us the favor of leading us through the resolutions?
Absolutely. Okay. Please let me know if I fade out and I will make sure I'm talking into the mic. But the first resolution that you have before you, it's the one ending 2391. That is a resolution to accept our annual agreement with the Department of Environment, Great Lakes and Energy, so EGLE. This is the former Department of Environmental Quality. This is our yearly agreement that supports a number of our environmental health services, so non-community water, drinking water, public pool inspections, septic, and campgrounds. The funding is just a little bit under what we got last year. Some of that is from a timing aspect. We often get an amendment of this throughout the year. And so that is kind of a business as usual 2021 agreement for your approval. The agreement does run October 1 to September 30th.
Just a question. I think the health department has been operating under some temporary guidelines for lake water contamination testing. Wasn't EGLE trying out some more immediate response type of tests, and is that still continuing?
Are you talking about for beach inspections?
Correct.
I do not want to misquote that, so I'm gonna make that note and bring that back to you. The state did have some new sampling and testing that they were operating under. I am not sure if we specifically were part of that program for the whole summer. That would come around though next summer. So we do our beach testing Memorial Day to Labor Day. But I will find it out and bring that back for you.
Yeah, if you just bump me an email on that one, because there was some controversy over why we were doing it, and then the state wasn't buying into it or something. It was their tests, but they didn't like them for some reason. Jill, you? No.
I can't answer any of those questions.
That's great. Thank you. All right.
We'll find out.
Good. Questions from you guys?
On that particular one, no.
Okay. We'll take them one at a time, I guess. All in favor of supporting the resolution? Dave?
All in favor, I say aye.
Yes. 3 yeas. All right. The stabilization grant?
Yeah, so this is the second grant and it's ending 2400. This is an acceptance of funding from the local community stabilization authority. So this is year 2 of this funding. We received a similar amount last year. And this has to be utilized in support of essential local public health services. I know it went to Annette. I'm not sure if it made it to you yet, but we do have kind of a brief overview of what essential local public health services are, just so you have an idea of what this needs to support. But really what that's looking at is our disease control and prevention. So infectious disease, sexually transmitted disease, hearing and vision services, our food protection services, public water, private groundwater, our sewage, and a few other aspects surrounding those categories. So it's fairly specific on what it can support. We do anticipate, we've at least been told we can depend on this yearly. So we have gotten year 2 of that funding. And so this is just an acceptance of that award.
It's a continuation of the same activity.
That is correct.
Okay, great. You have questions? Okay, Terry?
No?
No.
Okay.
That'd be
All in favor?
okay moving this forward?
Aye. Okay. 2 for 2.
All right.
Medical marijuana grant.
Yes, this is ending 2401. So this is a request to apply for funding to support the medical, or it's a request for the funding for medical marijuana operation and oversight grants. This is also a renewal, if you will. This would be the 3rd year this funding has been available from LARA. This is a little bit less of a competitive grant. It's more of LARA has divided up allocations for all counties, and we opt into accepting that allocation. It does require that we write a short work plan of how we would utilize those funds. It supports a lot of our public health promotion and prevention work around substance use. This would specifically help continue our Dirt on Weed campaign that you have probably heard about the last couple of years. We started that in year 1 of this funding, enhanced that last year, and there's more work that can be done there. So it is a request to apply and accept, or I guess to apply for that funding. We would bring back to you our acceptance of that, and can also provide a summary of what's happened over the last couple of years, but this is a renewal request.
Great.
I have questions on.
Yes, go ahead, Terry.
Courtney, I know, as you said, we've been receiving this for a couple of years, and this is for medical marijuana use. And I was just wondering, from the health department's perspective, what type of objectives and benchmarks are you using in order to see if this grant funding is worthwhile to be receiving to continue those efforts and put those resources toward this effort?
Yeah, that's a great question. Some of that is difficult to answer just because that local data or even statewide is hard to come by. But what we're really looking to do is decrease the use of marijuana for those who are underage, and to decrease its use, if not eliminate its use, for those who are pregnant and breastfeeding. Those have been the large focus of this. We work with all of the medical marijuana dispensers in the area to ensure that we have that information out there. One of the largest parallels in my mind to this that we've done for a number of years is we do alcohol and tobacco vendor compliance checks. So essentially, again, making sure we're following all alcohol and tobacco laws, who you can sell to, and all of those logistics. This is a similar standpoint that we have of trying to make sure those most vulnerable have that awareness, and that our vendors have the awareness of where they kind of fall in that legal obligation of where they sell to. So I think that what we're looking for is decreased youth use, and then decreased use for pregnant and breastfeeding women. The youth, we do have some data sources to look through that, and we're trying to increase them. There is a youth behavioral risk factor survey that is done every 3 years. Historically, Berrien hasn't always had a large percentage of our youth participate. Our EPI, Guy Miller, has been working over the last couple of years to increase our participation, because that would give us some of that data you're looking for.
Okay, and that survey would transpire in the near future then? Are we coming up to that 3-year mark again?
I believe we're probably a year, it should be next school year, so that usually happens within school settings. And I believe
Sure.
It should be in school year 2021, so next fall.
Okay.
Yep.
Thanks. I appreciate that.
Good. Dave, Questions?
Well, I think the state should have to worry about whether their money they're spending is worth it, and if they make it available to us, then we should grab it, because there's no way really of tracking, if we're focusing on the younger kids, there's no way of tracking them and knowing, you know, 3, 4, 5 years if they're smoking or if it had any effect on them whatsoever. But I think it does. You catch kids that early sometimes, you know, I mean, it's a great thing, but I don't think there's any way to know how it works. But if they want to give us money, I think we should take it.
Courtney, kind of off the rail question for you, but with the pandemic, we've lost sight of a lot of things like this that should be a public focus, if you will, from the health department. A similar one, do we know anything about vaping and what's happened with that in
Yeah.
the last 9 months?
So that is data that we're still trying to track. A lot of these aspects have lagging data, so we don't always know real time, unfortunately. But I mean, I can tell you overall, we have seen an increase in addiction and higher risk activities, and a lot of that can probably be COVID fallout. I mean, we've seen a little bit of an increase in drinking, and smoking is another coping mechanism that we know people turn to when that stress is increased, or just that idle time. And we know both has been a part of the COVID-19 pandemic. So I think a lot of this awareness and outreach and support work is as important as ever, especially knowing we have more months of our pandemic period to be in, and that we're going to have more of those impacts. So I think it's certainly been a increasing impact to our community.
Okay, great, thank you. Okay, trying to get money for marijuana. You guys okay with that?
Good with
Marijuana
moving forward.
education, yeah.
Okay, that one is approved. How about your fee schedule?
The fourth one before you is 2402. This is our, so every year we set our fees for clinical services and environmental health services. So what is before you is that 2021 fee schedule. This is set based on current rates. There's some comparison done on what the services cost among health departments, as well as intention given to what we bill for a number of our services, what we can bill to health plans for reimbursement for to cover the costs of those. And then in addition to that, just want to make note of, we do with all of our services, if someone is uninsured or underinsured, this is still paired with our county sliding fee scale that is based on the federal poverty guidelines that are given out every year. So these are costs at the most, and then there is the sliding fee scale, or these would be billed to a health plan or insurer. In the note that you have, if it's in color, there should be an attachment that goes over all of those fees. Those that are highlighted in yellow, you will notice are changes from fiscal year 20 to calendar year, 2021. And mostly are in our clinical health services. And sometimes that's also just medications and vaccine costs change for what it cost us to get them from vendors as well. That impacts those changes.
Okay, I've looked through these previously, but do you guys have any issues or?
Well, I had a question that I had sent off to Annette regarding the fee structure and if there were any changes, but Courtney just answered that, and it's attached with this resolution. And since it's standard and it's been reviewed by the health board and a number of other people that are above my rank and pay, I'll leave it at that.
They did send an email. Did you see that I did send the whole package?
No, I didn't.
Okay, I'm sorry. So yeah, I did send it to you. If you don't get it, let me know and I can
Oh,
send it.
you know why I haven't gotten it? I'm not connected to the counties.
Oh, yeah, so I did send that out, the whole packet. There's about 6 or 7 pages.
Okay, thank you.
Okay.
I appreciate it.
So we good with the fee schedule? Okay, very great. That one is approved as well, Courtney. You're batting 1,000.
Great. All right, last one. The last one that we have for you today is seeking your approval for a memorandum of understanding with Spectrum Health Lakeland, and this is specifically for emergency vaccine storage. We need that even in times not of COVID, but this is specifically being updated and brought to you all for approval for the potential need to store COVID-19 vaccination. If you've heard or followed news, one of the earliest vaccines set to be out is from Pfizer, and it requires a -70 Celsius storage. So a very ultra cold freezer temperature, which the health department does not have that type of a freezer. There's very few vaccines that would make it economical for us to have that here on site. However, Spectrum Health Lakeland at their St. Joe Hospital does have that capacity and is willing to support us with any Pfizer allotment we may get from the state to store that until we can get to the distribution aspect. They would also be able to support other vaccines. This would also support in an emergency. So should our units here malfunction or should the building lose power and our generators not come on, we are fortunate we have generators here. But if all of that chain of events were to occur, we could also transfer our vaccine to Spectrum Health Lakeland, have it stored there. They have various freezers and fridge that would be able to keep that appropriately. That would be good from a community standpoint of we wouldn't lose that vaccine capacity, and a financial standpoint of we wouldn't lose the hundreds of dollars in vaccine just that we store on a normal basis. So it's a COVID-19 immediate ask because we need it for that COVID-19 vaccine, but it also supports ongoing operations at the department. There is no financial cost to this. This is just an emergency storage agreement in partnership between the health system and the department.
Courtney, a question, and I don't know if this has been determined yet or not. Who controls? Now, Lakeland is going to possess the vaccine, but who controls the vaccine and the distribution process?
Yeah, no, that's a great question. That would be, it would still be Berrien County Health Department vaccine, just stored in their freezers. So it would be controlled for distribution by the health department and our response work. Spectrum Health Lakeland is a health system, will receive an allotment of vaccine, and that will primarily, at least in this initial allotment, be for their associates. So for their healthcare staff, for their doctors who have admitting privileges. The health department is available and responsible for the vast swath of everybody else in the community. So we would be the ones who then dictate the distribution of that. Of course, that's guided by CDC and state guidance as well, but it would remain with the county.
Okay, Brian?
Yeah, Mr. Chair, members of the committee, on Friday mid-morning, the health department did another one of their live updates with representatives from Lakeland. Courtney, I don't want to put you on the spot, but I was surprised by Dr. Hamill's notes or discussion on the number of vaccines that they'll initially have.
Small.
It's a very small number. Is that something that you could walk PHS through,
Sure.
just so that they understand exactly what they're facing?
Well, that's what Ezra was doing.
Yeah, absolutely. And some of this, what numbers I can walk you through are what the state of Michigan are expecting. We don't actually to date yet know what we expect to get here in Berrien, whether it be to the health department or the health system. But the state of Michigan is expecting just under 300,000 vaccines. However, that is not all at once. That is over the first 3 to 4 weeks of vaccine rollout. So that's not a huge number of vaccines when you're thinking the entire state and who you need to cover. The initial coverage of vaccine has been decided that Tier 1A will be healthcare professionals and long-term care residents and staff. So that being said, what's expected is in shipment 1. So week 1, which right now we're tentatively, these numbers are very loose, or dates I should say, but December 18th is kind of the targeted date for initial shipment. I honestly couldn't tell you if that means initial shipment to the state hubs that have been set up or to the counties proper. But sometime that 3rd to 4th week of December, week 1, we're expecting 85,000 vaccines to be distributed across the state of Michigan. After that, they expect another 100 and then like another 123 sometime in week 3 or 4. So in that first full month, we're thinking 300,000. There are a lot of moving parts. There's a Moderna vaccine that could up that number a little bit, but I think to our benefit, I mean, it's not a big number. There will be a scarcity of vaccine over the first few weeks.
Thank you.
Great. Hey, every little bit helps. Get it
Yeah.
going. You guys have any questions on that general topic? I know John Dwayne worked through the agreement with Lakeland, so we're okay on that one, right?
Yes.
And he actually changed that to an agreement, not a memo of understanding, so
Okay.
what you're authorizing is what he put together.
All right.
Okay.
So, questions?
I don't.
Okay, all in favor? Okay, well done, Courtney, as always.
Thank you very much. Appreciate your time.
Thank you. Have a good one. Okay, looks like Jill's up next.
I was just asked to come here in case there were any questions about the resolution.
It's a 395, and it's a household hazardous waste agreement amendment to continue it for 1 more year.
Absolutely.
And that's, and I did look, Commissioner Freeling asked me if John had taken a look at this, and I cannot find his written approved to form, which he sends me. So I have chatted with him, but I don't have that back yet. But I thought, you guys are here, let's have Jill go ahead and go it over, and of course, pending his approval, then I.
Is there any difference than what we've done in the past?
There's not.
I don't think
We,
there's any change.
went out to bid, Erc Environmental Services received the contract back in 2017. And in the contract, it was a 2-year contract with the ability to add a year for 3 years. And we're in the final, 2021 will be the final year of that original contract. They've provided excellent service, and they are keeping the 2020 prices through 2021 for us.
So they're able to still take everything that we can bring to them. I mean, there was questions about cardboard and certain other stuff that there was no aftermarket for anymore, but they're still providing the service on all levels for us.
They are taking our household hazardous waste, chemicals, old medications, as well as pesticides, which costs are covered through a state grant that was approved last week to renew that grant. And they also take our cardboard too, but just the ones that come in that are carrying, the boxes that are carrying the household hazardous.
Oh, okay.
So this is our hazardous waste and pesticide recycling and disposal company.
Absolutely.
I've already started a pile of different. I've gotten rid of a lot of it the last couple of years.
We're expecting a big event. If we
Some
can
old
hold it in
stuff,
April,
too.
it's going to be a big one.
This is a great service that's offered. My main question was whether or not we received that, because it specifies in the resolution pending approval or has been reviewed. And that's why I asked that question to Annette. So as long as he's got a chance to review it, I know that this is a great service. And we definitely get our money's worth of what they do and how they partner with us. So.
Yeah, and just to let you know, about approximately 25% of this program is paid for by the Clean Sweep grant that we get through the state, and 75% is covered by the landfill use fund dollars that we get from the 2 municipal solid waste landfills in the county.
And the tip, I mean, one closed. How are we set on tipping fees? Did they go up to cover that loss, or we just had a shortfall in income?
There's been some changes over the last few years, and that's kind of why now I'm switched over to the Parks Department, and funding went to the Parks Department, and the landfill use fund dollars that came into the county at the beginning in the late 90s built up to an account. And since then, we've been spending down that account. A few years ago, we spent, it was in the millions, we spent it out. So now the landfill use dollars that are coming in are diverted and used for these programs from the 2 remaining landfills.
But Parks is having a supplement.
A little bit, half of my salary is covered through the landfill use fund dollars and half is covered out.
And I guess I would be remiss if I didn't take this opportunity face to face. We had received, a couple of us commissioners, and I forwarded it on to Administrator Doucette, accolades for you and the program for the recycling that is done in Berrien County, how efficient it is run and how professional you are, the amount of volunteers that you are able to have come out and that you're able to give them charge of what to do, and that they were thoroughly impressed by the program that you offer. And so I'm glad I get to say that to you face to face, because it's an amazing program. And I'm glad that we have you here to offer.
We do have wonderful volunteers. I can say the events wouldn't be able to run smoothly without those extra hands and brains working out with traffic control. And we've had some awesome volunteers. I don't know how we get to be so lucky.
Well, I certainly appreciated the one in Buchanan when you added paper. And Mamie was crying. She was so happy about that.
Yeah.
And I really like the fact that we pulled up in this extremely long line of cars.
It was
And
a-
somebody said, "Oh, you just got paper, go over there."
Yeah,
Zip, 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 gone. It was great.
we
Great.
tweak it every year to try to make it a little more efficient so we don't have to have a long wait, hopefully.
Right. No, it's a great, great service, as Terry says. And thank you, Jill. You're an absolute magician at getting all that done. Thank you.
And great for my house.
We,
Shed and
Yeah.
whatever else I got out there.
Okay, we're approving that one to go to full board?
So I think,
Yes,
Yep.
done.
yeah, I.
Thank you.
Thank you.
Thank you.
Leave me for anything else?
I was trying to pull up a picture you forwarded this summer. It was the traffic jam of just how busy that event was. I'll find it, but
That was our Love Creek, our first event of the year after 2 canceled events. Was not as busy as we were expecting. It was the same as last year, and the next event went up about 80% in participation level, and that's the picture you've received.
Oh, Buchanan?
Love Creek
Oh,
Nature
Love
Center
Creek was the
in
Buchanan.
August. People came out there, which means all those people came out and saw that beautiful park who
Good.
may not have gone out there otherwise. So it's been an interesting year.
It's in your weekly update.
yeah.
August 14th.
Look at you.
Yeah. Oh, thank you, Jill.
Okay, thank you.
Thank
Have a great holiday.
You too.
Thanks, Jill.
Okay, I thought we'd already done the appointed and non-union salary increase of 2%, but is that not true?
That was where the confusion came for us at the board meeting, because our conversation had been the appointed non-union, and we were talking about elected, which was a couple weeks earlier we had approved and moved forward.
Oh.
And so
Okay. So this is just a parallel to what we've already done for ourselves.
Yeah.
That's fair.
Yeah.
So,
I did send that to you, but you probably have not had a chance to look at it yet. It was like right before this meeting. So I did send you the resolution and the attached documents which show the change, the budgeted change that would be in place if you approved it.
okay. I'm apprehensive to ask this question, but does the resolution provide 2% both years?
No, just one.
Yeah, Shelley's on there too.
Oh, hi, Shelley.
Hi, it's just 1 year.
Okay, just 1 year, even though the thing we passed before was 2 years.
And
So-
that was the difference, because our appointed is 1 year, our elected, because it's based on term, is 2 years. And that was where the confusion lied.
Got it.
Clear as mud?
Clear as mud. Good luck to all of you.
367 is the number. It's built into your budget, and I'll be, the signing party just noted that I'm not part of that salary schedule, so I can sign it with clean hands.
Oh, okay.
Because your salary is tied to a separate resolution that we normally do after evaluation, and it's normally based on whatever we do as the elect,
Yes,
that then,
yeah.
that is what your increase would be.
Yep.
So that, again, clears my, but
Right.
it does make sense.
I said, good luck to you.
Thanks.
Okay, are we okay with that? 2% for the appointed and non-union salary increases.
Certainly needs a little bit forward.
That's approved by us, Annette, thank you.
Thank you.
Board appointments.
There are two of them that come to this committee following the process and in your policy. I come to the parent committee and bring them to you first, and then you can hopefully make a recommendation to the full board to, in this case, I have two reappointments for you. One is for the Department of Health and Human Services, Ms. Bursaw, who has been there since 2017.
What was the name?
Bursaw, the last name?
Jan Versailles.
Jan Bursaw.
I thought you said bird talk. I'm sorry.
Oh, no.
That's not.
And her attendance is solid, 100%. She's actually the chair, I believe, of that. And then the other one is Richard Schinkel. He dates back to pre-1993. We don't have any records prior to that in the board appointment process. So,
I think he came to us with Love Creek or something.
oh, really?
He was, well, no, I'm being facetious. He was at Love Creek and we acquired the property and he came to us. But
Oh, he came with
Dick is a gem and a great chair for the Parks Board. And,
Like it to be noted, I was starting my sophomore year of high school, the year he was appointed.
he does a great job for us, and because of his experience, he knows everybody and everything. Not as good as Annette, but pretty close. So are we good with these reappointments?
They're still good, I'm good.
Great, those are approved.
I will put those on the agenda then for this week, and then it'll refer back to PHSC's recommendation, and then you guys can talk about it.
Yeah.
All right?
Okay,
Fought for
All right. And then I'm gonna go and check for some public comments.
please.
Oh, I'm the only one watching. I think, we'll just make sure. Nope, no public comments.
All right. The next item on our agenda is a personnel matter. This will be a subject of discussion before PHSC based on a complaint by an employee. Mr. Dissent, I think the question to you is whether you would like this to be an open or a closed session?
Close.
Okay. To close this session, we need a 2/3 vote of the PHSC membership.
I'll make the motion.
Okay. Annette, would you call the roll, please?
Commissioner Chickering,
Yes,
Commissioner Mulrath,
Yes.
Commissioner Freeling.
Yes.
very good.
All
Excellent.
close.
We will go into